Welcome, everyone. Our webinar topic for today will be how scientifically design a skincare regimen. Before I turn things over to our distinguished presenter, I want to go over a couple of housekeeping items. This webinar is scheduled for 1 hour. You will have the opportunity to submit your questions throughout our presentation. To send us a question, please use the chat box in your webinar control panel. You can type your question and submit to organizers only. We have set 15 minutes after the presentation to answer your questions. We will also be doing future webinars in other topics, and our next webinars are scheduled for August 12th and August 26th. This webinar is also being recorded and will be available for anyone that they can see it at their own convenience. And now it's my privilege to introduce Dr. Leslie Baumann. Dr. Leslie Baumann is a board-certified dermatologist, researcher, and author. She was the director of the Division of Cosmetic Dermatology at the University of Miami from 1997 to 2006. Dr. Baumann clinical trial research has been instrumental in the FDA approval of Botox, Dysport, Kybella, Voluma, Sculptra, UltraShape, and many other aesthetic treatments. She authors twice monthly column for the Miami Herald newspaper, Dermatology News, and she writes a column on cosmetical ingredients. She also holds 4 patents on methods to improve skin health and appearance. And without further ado, Dr. Leslie Baumann, welcome.
Hi, thank you very much. I'm going to be turning on my slides. Go back, here we go. So skincare regimen design, my favorite topic, and we're going to be talking about all the different things you have to think of when you make a skincare regimen. The first thing you need to do is diagnose the skin type before you do a regimen, because not everybody's skin is the same, obviously, and a lot of companies will want you to think that their one product is right for everyone, and that just isn't true. But also the same regimen isn't right for everybody, so you really need to take a lot of different things into account when you're designing the regimen. When you're thinking about the skin type, I don't want you to use the Fitzpatrick skin type. A lot of people talk about the Fitzpatrick skin type and they don't really understand what it means. It was originally designed to help the doctors know what joules or what amount of power was necessary with the light treatments to treat psoriasis. So it really pertains to a tanning response to ultraviolet light exposure. So Dr. Fitzpatrick realized that white-skinned people's tolerance level to oral UVA could not really be based on the skin color, and eye color and hair color. So, for example, some people who are blonde hair with blue eyes tan and don't burn, while other ones burn first. So he realized that he needed to adjust the joules of the light based on this Fitzpatrick skin type. So the Fitzpatrick skin typing system is great, but it is not about skincare at all. It's about response to ultraviolet light. So I developed my own skin typing system in 2004, and I like to take into account the 4 main barriers to skin health. And these are the 4 things that if your skin has these, your skin isn't as healthy as it should be. So the first one is dehydration. The second is inflammation. The third is pigmentation. And the 4th is aging. And so those are the 4 barriers to skin health. And with the nomenclature of my skin typing system, I use the words here to point these out. So oily versus dry, they would be a O or a D. Sensitive versus resistant, they would be a S or a R. Pigmented versus non-pigmented, a P or an N. And wrinkled versus tight, a W or a T. And tight is really for people who are under 20 who don't really need anti-aging ingredients yet. That's your acne patients and your eczema, your young kids. So the skin typing system works for all different ages, all different ethnicities, and all genders. But it's based on these 4 parameters, these 4 barriers to skin health. Now, in order for the system to work, people need to be able to accurately diagnose the skin type. So I realized back in 2005, if I wanted my staff to be able to help me with this process, I needed to have a validated questionnaire. So I actually spent years validating the questionnaire to make sure that it accurately diagnoses the skin type. So what we did with this is we did things like measure sebum secretion and compare that to the questions on the questionnaire, or measure transepidermal water loss and compare that to the questions on the questionnaire. And we were able to take a 300-question questionnaire and get it down to a 3-minute questionnaire, which is obviously very helpful. So in 3 minutes, you can learn a lot about your patients, and you know that it will give you a valid skin type. So the skincare, whenever you design a regimen, you need to keep the skin type in mind. So the way we do it is we do a quiz. It picks one of the 16 skin types, and then there's a regimen. So when you design the regimen, you need to consider the order of the products and the time they're going to be used. So products that are light sensitive, like vitamin C and retinol, need to be used at night, and obviously sunscreens need to be used in the morning. And whenever you choose the products, you want to choose products that have ingredients that are right for the skin type. So each skin type has different ingredients that can be used and different ingredients that should be avoided. So that is very skin type specific. Now, when you put these products on top of each other, I call that product layering. So in this picture, the orange would be the cleanser. It goes on first, and then the purple is the eye cream. It goes on second. The third is the treatment product. As you're layering these products, they're all affecting each other. And I like to use colors to show this. So for example, if one product that you're putting on is orange and another one is blue, when they're on the skin and they mix together, they make this third green product. And basically what that means is when you combine products together, you're going to have effects on the activity, penetration, solubility, and stability. And that's really what we're going to be talking about today, is how these things interact with each other and what you need to consider. Now, some ingredients are very reactive. They don't play well in the sandbox with each other. And they're very difficult to formulate and very difficult to use in a regimen. One of the most well-known ones is ascorbic acid or vitamin C. We're going to be talking more about that one later and why it's difficult. One that most people don't realize is benzoyl peroxide. And the way that benzoyl peroxide works on acne is it actually makes free radicals, and that kills the acne bacteria. But those reactive free radicals also can interfere with other ingredients and other products. So benzoyl peroxide doesn't play well in the sandbox with other ingredients. Hydroquinone is another one that's hard to formulate and hard to mix with other things. Peptides really are so reactive. People don't realize there's so many peptide-containing products, and they are very, very difficult to work with other products. So be wary of the peptide products. And lastly, retinoids. Retinoids can react with other products too. So every product should improve the efficacy of the other products. So you want to make sure you're using products that enhance each other instead of hurt each other. So in order to talk about the science, I think it's best that we're all on the same page and we all talk about the same basic regimen structure. So this is the methodology of the regimen structure that I like to use. In some cases, 2 steps might be one product. You don't always have to have 5 steps in the morning and 5 steps at night. But in general, this is how you should think about the regimen design. Basically, obviously, you're going to do cleanser first. The second in the morning and night is an eye product. And the reason that goes next is because it protects your skin from the third product, which is the treatment product. And the treatment product is really defined as the important one that's treating those underlying barriers of skin health. So this could be an acne product, it could be a melasma product, it could be anti-aging, it could be something that's a combination of those. But that third step, that treatment product step, is the most important, and really the whole regimen is designed to improve the efficacy of that third treatment product, that third step. The fourth step is a moisturizer, and moisturizers provide occlusion and push things into the skin. Dermatologists all learned in residency, if somebody has psoriasis and the skin's super thick, we would put the medication on and then wrap it with saran wrap to push it in the skin. Well, that's the function that a moisturizer plays here, is like that saran wrap. It helps push that treatment product into the skin. And then in the morning, on the 5th step, you have a sunscreen, and your last step at night is a retinoid, if the skin type needs a retinoid. So again, in general, this is just the general regimen structure. So first we're going to talk about cleansers and moisturizers. And the reason I chose to do that first is because a lot of times people don't realize how important the cleanser and the moisturizer are. They'll tell patients, oh, just get whatever cleanser, use whatever you have at home, use a Cetaphil. But really, it's critical that you use the right one, and I'm going to show you why. We're going to focus on cleansers first. So what do cleansers do? Well, they prepare the skin. That's really their main role, and they're going to remove lipids. Some of them will. The foaming ones will remove lipids. The non-foaming ones or the creamy ones will deposit lipids. All of them will affect your pH. All of them will loosen how tightly the cells hold on to each other. Part of that is because of water and the friction that you're using, but also some of the components of the cleansers make cells let go of each other. And this promotes desquamation, or the old dead skin coming off of the top layer of the skin. So cleansers affect the skin barrier, and I love talking about the skin barrier, so I'm going to give you a pretty good barrier background that's going to explain to you why cleansers and moisturizers are so important. So what is the skin barrier? Well, it looks like a brick wall. The bricks are these little pink rectangles, and the mortar are these lipids, the blue and yellow that you see here. So the pink are the skin cells, which are called keratinocytes, and they're surrounded by lipids. And these lipids are what we call the skin barrier because they're protecting the keratinocytes from a lot of things. So where is the skin barrier? Well, it's in the epidermis, which is the top layer of the skin, and it's actually that very top layer of the epidermis that we call the stratum corneum, or sometimes you'll see it referred to as SC. So the stratum corneum has a big layer of dead skin cells, and they're all surrounded by the lipids, and it plays the most important role in barrier repair and protecting the skin. Now, a little side tidbit is your lips don't have a stratum corneum. That's why your lips get so dehydrated, and you can get a chapstick addiction because you just don't have the stratum corneum on your lips that helps you hold onto water. So the stratum corneum is made of these keratinocytes, those bricks, and if you look between them, you see these bilayer membranes made of lipids. And actually, there's several bilayer membranes. It's not just one. There's actually multiple bilayers in between the keratinocytes. And if you look up close at these bilayers, they're made of three main lipids. You have cholesterol, ceramides, and fatty acids. And those are the three most important lipids to make up the skin barrier, and they come together to form a puzzle. Imagine that they're three-dimensional puzzle pieces that need to fit together exactly right to keep water in the skin and bad things out of the skin. Now, many studies have shown that a ratio of 1 to 1 to 1 of these lipids is optimal. And this is very well known. This study was from, I think, the 90s, from a long time ago. And we know that if you put cholesterol only on the skin or ceramides only on the skin, that actually hurts your skin barrier. You need to have a ratio of 1 to 1 to 1. You need all three of them. And most of the moisturizers on the market do not use the proper ratio, which is surprising to me. There is a prescription medication called Episerum, or Episeram, however you want to say it, and it's about $350. It's a great moisturizer, but it is prescription strength for eczema. There are a few other non-prescription ones that are available that have the right ratio, but surprisingly, most moisturizers don't have the right ratio and actually can injure the barrier. So it's important to know what's in your moisturizers. Now, this is what the healthy skin barrier looks like. It's got the 1 to 1 to 1 ratio. It's three-dimensional, and it's watertight. So the way it's watertight is that these little lipids have heads and tails, and the heads are called hydrophilic. They love water. And the tails are hydrophobic. They hate water. And when they line up, all the little tails come together, and it makes this hydrophobic area that repels water. So whenever water tries to pass through, it can't get through that bilayer membrane, and that is what prevents the skin from getting dehydrated. So I always tell my patients it's not how much water you drink that determines how hydrated you are. I mean, of course, it's important to drink water, but you can drink gallons and gallons of water, and if your barrier is impaired, the water is going to just evaporate off. So it's important that the skin barrier is intact to be able to hydrate your skin. So how do cleansers play a role with the skin barrier? They actually are critical, the skin barrier. They affect the skin barrier almost as much as moisturizers do. So you have two main categories of cleansers that we're going to talk about today. One is foaming cleansers that are bubbly, and they injure the barrier actually. And then you have your non-foaming cleansers that are usually kind of creamy, like a Pond's cold cream type thing, or something that doesn't foam. And those can preserve the barrier because they have a lot of those lipids in them that they deposit on the skin. So what makes the foaming cleansers foam? Well, they have detergents in them, which are also called surfactants. And that's what's in laundry soap and dishwasher liquid and shampoos and bubble baths. And that's what makes things foam. So detergents make things foam, but they're also used for cleaning. Because what happens is these little gray balls that only have one tail are able to get down in between those lipids and pull them away. And that's how they get lipids and grease and oil and debris off of your skin. So these foaming cleansers or detergents actually can damage the barrier because when these gray little balls with the one leg get in between the blue and yellow lipids, they actually separate them up and break them apart and cause a barrier. So then when you have a hole in the barrier, water can evaporate out, and we call this transepidermal water loss, or you'll hear it called TEWL. In fact, the meter that measures evaporation off the skin is called a TEWL meter, and that comes from transepidermal water loss, and this causes dehydration. So obviously you don't want this. This is actually also one of the things that causes eczema. Now, when you have this disrupted skin barrier, bad things get in too. So allergens get in, irritants and bacteria. So this is why people with an impaired barrier are more likely to get contact dermatitis and irritations on their skin. Now, what's interesting about oily skin people is they make sebum, and sebum has a ton of lipids in it. And so the sebum actually coats the top layer of the skin, and this protects oily skin people from dehydration. So oily skin people could have an impaired barrier, but it doesn't matter because they actually fix it themselves by making sebum. So we usually don't worry as much about an impaired barrier on the face in people that have oily skin. The reason I say on the face is because if you have eczema on your body, that's a different story. We're focusing on the face here. Now, if you have excessive sebum, the people who have oily skin complain about feeling greasy or looking shiny or having to powder their face during the day, and they worry about their pores getting clogged. So oily skin people want that squeaky clean feeling, and they prefer foaming cleansers. And the reason is these detergents come in and they surround that sebum or those sebum lipids, and they pull them away from the skin and leave the skin clean. And we don't worry because we know the oily skin person is going to make more sebum, usually within 20 minutes, and then they repair their own barrier. So a lot of times oily skin people don't need a moisturizer at all, or they can get away with a lighter moisturizer. And sebum is occlusive, so it covers the surface of the skin and helps prevent water from evaporating off. And so oily skin people have a little bit of extra protection. I always tell my oily skin people, you're lucky because the sebum not only protects you from dehydration, but it also has a lot of antioxidants like vitamin E in it that helps protect skin from aging. So there's a good and a bad side to everything. Okay, so we're back to cleansers. So if you have a patient with oily skin, you want to choose a foaming cleanser. If you have a patient with dry skin, you want to choose a non-foaming cleanser. Now, cleansers can also affect the skin's pH. And if you remember, a lower pH is acidic and a higher pH is alkaline. And foaming are a pH of 10, which is very, very high. The skin likes to be 4 to 6, and vitamin C serums like to be around the 2 range to get in. So you can see that cleansers can dramatically affect the pH of the skin. So if you use bar soap, for example, you may raise the skin's pH to 9 or 10, and this is very damaging to the barrier also and causes all kinds of issues with different processes in the skin. And this is why when you have patients that use Irish Spring on their face, they start to get irritated, and it's not a great idea to use bar soap on your face. Now, acidic cleansers are very popular because lowering the pH of the skin is helpful for lots of reasons. One reason is it helps desquamation. Another reason is it helps prevent bacteria from growing on the skin. So I like to divide cleansers into 2 categories. One is salicylic acid cleansers and one are hydroxy acid cleansers, like glycolic acid, for example. And these decrease the skin's pH down to 2 to 4. And this study shows that the pH directly affects the skin barrier. So whatever cleansers you're using matters for many different reasons because it has such an effect on the skin barrier. Now, pH of the skin will affect penetration of that treatment product that you put on later. And you may remember this study that Dr. Pinnell from Duke did where he looked at topical vitamin C, and he showed that it penetrates into the skin best at a pH of 2. So that's a very low pH. You would not want to use a soap cleanser right before this and raise the skin's pH because then when you put your expensive vitamin C serum on, it's not going to penetrate, and it's a waste of money. So it's a lot better to do some sort of hydroxy acid or salicylic acid cleanser on the skin first before you use a vitamin C product. Okay, now we're going to talk about moisturizers and what role they play. So moisturizers also can repair the barrier, and they do this by depositing lipids on the skin, and this affects the skin's penetration, and of course that will affect efficacy and side effects. So I've had a lot of doctors who are using a system that I created. It's software that helps generate regimens. And we have over 175 doctors that are using the system. And a lot of the dermatologists call me and say, I can't believe how much better my acne patients are tolerating their regimens now that I'm giving them the specific advice. And one of the main reasons is because of the moisturizers and the cleansers. If they're using the right moisturizers and cleansers, they're more likely to be able to tolerate their benzoyl peroxides and their retinoids. And we're going to talk about why that is and why moisturizers matter so much in helping you tolerate other things. Okay, again, we're talking about the skin barrier, same thing you learned a minute ago. But the fatty acids are actually, there's lots of different fatty acids. So when we tell consumers to look at the label and make sure there's cholesterol, fatty acids, and ceramides, it's difficult for consumers because it doesn't say fatty acid on the label. It'll usually say an ingredient like coconut oil or argan oil or shea butter, and those ingredients have fatty acids in them. So you can't really look on the label to know what fatty acid is in the product. And that's a shame because fatty acid choice is critical. So if you look at the shape of fatty acids, you have those heads and tails I talked about, but the shape of the tails really depends on a lot of different things in the chemical structure. So if we look at the green one here, stearic acid, that's my favorite fatty acid for dry skin. It has these straight legs that stick down, while oleic acid has these legs that kind of stick out to the side. And this matters because if you imagine that three-dimensional shape of the barrier, when you have the oleic acid as your fatty acid and those legs don't come close together, you end up with these little holes in the barrier or spaces in the barrier where these green arrows are. And that is identical to having a hole in the skin barrier because things can pass through that space. So you want those legs of the fatty acids to be closer together so the lipids will pack in tighter. So ingredients can influence penetration. So if you're using oleic acid, things are going to penetrate more because of those little holes we just talked about. If you're using stearic acid, things are going to penetrate less because those legs are closer together. So ingredients dramatically influence penetration. One thing that people don't realize is olive oil has a lot of oleic acid in it. And there's all kinds of studies to show that oleic acid increases penetration of other things. Now, there are situations that this is a good thing, but there are many situations that this is a bad thing. So I had a patient who, every time she would go on a trip, she would get really bad eczema from the detergent in the sheets in the hotel room. But she wouldn't get it at home, and it was very odd. It took us a long time to figure it out. It turns out she was taking a little bottle of olive oil with her on her trips and moisturizing her skin in the hotel with the olive oil, thinking that was going to protect her from the detergent in the sheets. But actually it was making a little open highway through her skin barrier for all the detergents. It was actually making it worse. So just switching over to a different oil, like an argan oil or a safflower oil, would solve that problem. So olive oil is really not a great moisturizer for your skin unless for some reason you're trying to get a medication into the skin better. There's all kinds of penetration enhancers and moisturizers. Isopropyl myristate is an interesting one because it is also in hair conditioners. It makes your hair smooth, and it causes acne. So you don't want isopropyl myristate, especially in a teenager or an acne-prone person. Isopropyl myristate is in Retin-A. You're going to be surprised when you look at the label. Can you believe that a drug approved for acne actually has an acne-causing ingredient in it? And because it got approved by the FDA, all the generics that came out have to be the same formula. They have it too. And that's why some of the newer formulations like Retin-A Micro and Altrino and some of those are actually better because they don't have isopropyl myristate in them. So take a look on your retinoid label. That's one of the reasons I prefer retinols actually, because retinols don't, I've never seen a retinol with isopropyl myristate in it. Propylene glycol is something that they put in a lot of things as a penetration enhancer, but it can be very irritating for obvious reasons because it can bring allergens in as well. And then glycerol. Hyaluronic acid increases drug delivery, and most people don't know this. And HA is a very common ingredient now. All kinds of products have it, and there's something wrong with using HA if it's used properly. So if you want to increase the penetration of something, if you put one of these hyaluronic acid serums on top of it, it will make it penetrate better. But what if you're trying to get your patient used to some kind of retinol? Using a hyaluronic acid product is going to increase the side effects they get with the retinol. You would never use it with acne medications, for example, especially when you're starting out acne, because it would make more get in the skin and would irritate the skin. Now, if you're trying to give them some really expensive anti-aging serum that's hard to get in, then this would be a good thing to put on. So again, you need to think about what you're trying to do when you choose these moisturizers. Now, sebum, of course, can also affect transdermal delivery. The lipids that the sebum deposits on the surface of the skin prevent penetration. So that's another reason why you want to use a foaming cleanser when someone has oily skin, because you want to get all those lipids off the skin. So when you apply your treatment product, it can actually penetrate into the skin. Okay, so we talked about cleansers and we talked about moisturizers. Now we're going to talk about the treatment product, step 3. I made it pink because it's really the most important one. And I don't have time today to talk about every kind of treatment product, so I'm going to focus on pigmentation today. And then in the future, I'll have a webinar that talks about acne and another one that talks about aging. So we can go through each one of those and talk about all the things you need to worry about. But right now, since everybody's talking about melasma and all the different new treatments for melasma, I thought it would be a good time to talk about pigment. So we're going to talk about skin lightening treatment products. So first, let's do a little basic science. If we go back to the skin, you see you have the epidermis on the top and the dermis below, and then you have these cells, melanocytes, and the melanocytes move all around, and they're in the dermis and the epidermis, and they have these tentacles that kind of move around in between cells. And these melanocytes, I think they look like octopus, so that's why I drew a little octopus picture. They actually make melanin, the pigment, the brown stuff, and they package it in these little football-looking things that are called melanosomes. Anytime you see the word some, it means like a holder or a compartment. So a melanosome is something that holds melanin. So these little melanosomes package up the melanin, and they carry the melanin through these tentacles and move it into skin cells, actually. So how is the melanin made? Well, there's actually two kinds of melanin. There's eumelanin and pheomelanin, and those are responsible for your skin color. So we have different combinations of these, and that's why people have different skin colors. And what happens is you start out with tyrosinase, and you end up with these two kinds of melanin. And the most important step is where this green arrow is right here, and that is called tyrosinase. So tyrosinase is the enzyme that is necessary to make melanin. So this is what we call it the epidermal melanin unit. You have your pink keratinocytes, you have your octopus-looking melanocyte, and then what happens is the melanocyte uses tyrosinase to make melanin. It packages it in these little melanosomes, They move up the tentacles, and then they go through a receptor that's like a key and a lock called the PAR2 receptor or protease activated receptor 2. And it goes through the PAR2 receptor and goes into the skin cells. So some ingredients actually will try to block that PAR2 receptor. Some ingredients will block tyrosinase so that you don't make melanin. And other ingredients will try to speed up how fast new cells are made so that the skin can't keep up and can't make pigment. Those are all different strategies to even the skin tone. So this is what it looks like whenever melanin is made. You see, melanin is made, it goes in these little melanosomes, and then they move into the keratinocytes, and they cause pigmentation. And this is a constant process that's happening all the time, and it gets turned on by ultraviolet light, melanocyte-stimulating hormone, which actually gets turned on by stress, and many other things. This is the tanning response that protects our DNA from the sun. So what are the targets for skin lightening then? Well, you have tyrosinase is the enzyme that's necessary to make melanin, so there's all kinds of tyrosinase inhibitors. You have the PAR2 receptor. There are different ingredients that'll block that. And then these melanosomes, these footballs full of pigment, if you can desquamate those off or get those to flake off of the skin surface and be replaced by new cells that don't have those, that will even out skin as well. Now, tyrosinase inhibitors are notoriously unstable and reactive. They are hard to formulate, so you have to be careful with them when combining with other products. So we did the original Triluma trials back in the 90s. I think it was 1998. It was one of my first research trials before we even did the Botox trials. And it took them a long time to figure out how to mix hydroquinone, a steroid, and tretinoin, which is a type of retin-A, all together into one thing. And this was mainly because hydroquinone is not very friendly in the sandbox. So many of the tyrosinase inhibitors are difficult. So hydroquinone is unstable because it oxidizes really fast. The good thing is it turns brown when it's oxidized, so you can tell when your cream has gone bad because the color does change. So I always tell my patients to throw it out within 3 months of opening it, but also they can tell by the brown. A lot of times you'll get a little brown cream around the edge that gets when it gets exposed to light. Now, hydroquinone doesn't penetrate the skin very well because it has this hydrophilic structure. So it often needs to be combined with other things that help it penetrate better to make it more efficacious. And those of you who treat melasma know how hard it is to treat melasma. And those are two of the reasons. One, hydroquinone doesn't play well with other ingredients. And number two, it doesn't penetrate very well. Now, a lot of people are afraid of hydroquinone, although I feel it's safe. The big survey of dermatologists feel it's safe. And especially in America where we don't see a lot of the issues that they can have in China with different enzyme problems that cause problems with hydroquinone. So I love hydroquinone. I use it a lot, but a lot of times you'll have patients that don't want to use hydroquinone. They'll want an alternative. And a lot of people choose Arbutin as the alternative, but what's interesting is it's a derivative of hydroquinone. If you look at the structure here, it is very similar to hydroquinone. The only difference is that these groups here, the R1, the OH, and the O-beta glucose are a little bit different. Now, what's interesting is Arbutin, it breaks down 4 times faster when the pH is high than when the pH is low. So if you have a lower pH prior to putting on the Arbutin, you're going to get a better response because it's going to last longer on the skin. Because remember, when you put these tyrosinase inhibitors on the skin and light touches it, they start to break down right away. So Arbutin, if at a lower pH, is going to work better than at a higher pH. So pH affects the efficacy of products. Absolutely does. So I want you to start thinking about pH every time you design a regimen. And the most common one that we talk about is this ascorbic acid, and I mentioned it before. Ascorbic acid, vitamin C, is a really great ingredient. It does a lot of important things, helps you make more collagen, helps protect your collagen, it's an antioxidant, it helps even skin tone, but it falls apart whenever it touches air or light, and it's not absorbed very well. And it's very expensive. So you definitely want to make sure it works right. And so you want a pH as close to 2 as you can get in order for it to penetrate properly. Okay, so how are you going to make your tyrosinase inhibitor products work better? Well, the first one is you need to avoid light and air. So the way the product's packaged matters. You want an airless pump. You don't want a big jar. I have patients come in with those big jars of hydroquinone they bought on Amazon, and it just is not going to work because every time you open it, air gets in there. So you need to avoid light and air. You want to combine with penetration enhancers to increase absorption. So in this situation, hyaluronic acid would be a great choice. You want to combine with antioxidants because antioxidants will help prevent the tyrosinase inhibitors like hydroquinone from breaking down so quickly. So if you can find friendly antioxidants that won't affect the efficacy, those will help. And then you really want to avoid mixing any tyrosinase inhibitors with any kind of peroxides like benzoyl peroxide or hydrogen peroxide, because those will just inactivate each other. So this matters if you have an acne patient that gets a pimple and they're left with brown spots, and you're treating the brown spots and you're treating the acne at the same time. This can play a role. So again, knowing the patient's skin type is key when you're thinking about all of these things. Now, hydroquinone should be used with an antioxidant product because it specifically causes depletion of glutathione, which is a very important antioxidant that our skin makes. It's protective, so it uses that up, so we need to replace it with more antioxidants. And hydroquinone generates free radicals, also known as reactive oxygen species, and causes oxidative damage of membrane lipids and proteins. So it's safe, but it also can cause some aging things if you're not using it with an antioxidant. So I hope that you now see how cleansers and moisturizers can affect the efficacy of many different things. And we're going to talk a little bit about how they affect the efficacy of skin lightening ingredients specifically. And they do it by affecting the solubility of the ingredients, the stability of the ingredients, how hydrated the stratum corneum is, because the wetter, more hydrated it is, the more things can get in. It affects desquamation, they affect the pH, and they affect occlusion. So fatty acids that are in the moisturizers actually can affect tyrosinase and how well tyrosinase works, which is, I think, very fascinating. So it turns out that unsaturated fatty acids like alpha-linoleic acid and oleic acid will decrease tyrosinase function. So that means olive oil actually makes you make less pigment. While linoleic acid and alpha-linoleic acid, they increase cell turnover of the stratum corneum, and that causes desquamation. So that also helps pigment. So the unsaturated fatty acids help prevent pigmentation. While on the other hand, the saturated fatty acids like palmitic acid actually increases tyrosinase function. So whether you're wanting the skin to lighten or darken will help determine which moisturizers you want to use and which fatty acids you want in those moisturizers. And I drew a little diagram here to kind of help you remember that the green, blue, and orange ones here, they decrease tyrosinase function, while the pink one, palmitic acid, will increase tyrosinase function. So as you can see, designing an efficacious regimen takes time, and it takes a lot of thought. You have to think about ingredient combinations and ingredient reactions and what order to put the products in, and you have to think about the do's and don'ts, and you really need to know a lot of different things. And then you need to educate your patients too, because it's not enough for you to know these things. You also have to make sure the patients are putting the products on in the right order. And the more they understand about why it matters, the more compliant that they'll be. So it's impossible to do this at the patient's bed, at the bedside or the exam table side, because there's just we're all too busy. We don't have enough time. So what I did when I was at the University of Miami in 2005 is I came up with a system that would allow my staff to do the same exact good skincare regimen design or advice as I would do. So I developed software, and the software is based on a questionnaire that identifies the skin type and then automatically generates a regimen based on all those things that I just talked about. So you take the quiz, it makes a regimen, And then the patient gets all the educational material in a mobile app that they need to support them and understand why they need to do everything. On the mobile app, they can click to refill the products, no problem, and they can click to get more information about their products. So it helps them get the right information and helps keep them educated and engaged. And we have allowed doctors to use our software. We started out with dermatologists, and after we had about 100 dermatologists, we started letting plastic surgeons and some other doctors use the system. And we have looked at every touch point with the patient from the time they hear about your practice to the time they leave and refill products. And we've looked at each step of that, and we've figured out how to maximize educating the patients and motivating the patients to be compliant and having your staff help the patients without it being any extra time to the medical provider. So for example, step 1, we have a lot of online education before the patient even gets there. If the patient kind of understands it's important to know what the skin type is, this is what melanin is, this is what aging is, before they even get there, it makes it easier. And then we train the front desk with scripts of when the patients ask questions. In the waiting room, they take the quiz at step 3. Step 4, they find out their skin type. Step 5, they go into the exam room and the staff member clicks a button and everything they need to tell the patient is right there. And they can discuss with the patient and make sure it sounds doable for the patient. The number of steps in the regimen makes sense. If they want a tinted sunscreen or a non-tinted sunscreen, all that is figured out. Then the staff comes and tells the provider what's going on. My staff will say, Dr. Baumann, this patient is OSPW. She only wants to use 3 steps in the morning and 3 steps at night, and here's her regimen. And I just have to glance at it and write, it's already right. It's perfect. It's so easy. Then the provider comes in, looks at the patient, makes sure that they agree with the regimen, and they click a button that approves it. And then that makes it go into the patient's app, and the patient can buy the products online, or they can buy the products from the office there with the cashier. And I like my patients to come back. I'm on step 14. I like the patients to come back at 1 month. I take hand-filled camera images at that time. I adjust their regimen, and I believe that patients should be seen every month in the beginning because you tweak their regimen as those barriers to skin health change. So their skin type's going to change as it gets less dehydrated and as it's less inflamed. So they need to get a new regimen every month from you. They can refill online. And then because they're compliant, they're using things properly, they're using the right things for their skin type, their skin health gets better, and you see that their skin type will change. So you're probably thinking, oh, well, I already like the brand that I sell in my practice. Well, we have tested over 40 brands, so the system works with most brands. And the way it works is, for example, I like to use non-foaming cleansers as an example. To be a Skin Type Solutions approved product in the system, there are certain requirements that your product has to meet. And so, for example, with non-foaming cleansers, it can't have detergents in it. That makes sense. And there's lots of things that it can't have in it, and there's lots of things it must have in it. So if the products meet those specific requirements, they get approved to be in the system. So if you decide to use the software, this is how it works. The first time you decide when you're ready to go with your office manager and estheticians and you get together and you figure out what you want to sell, you go into our software, which we call the Regimen Management Software, and you would click Non-Foaming Cleanser. And there's a drop-down menu of all the different non-foaming cleansers that meet the criteria, and it shows you the price to the patient. And you can choose to sell products by the price, by the brand. Some people want to do private label. There's all kinds of choices, but the beautiful part of it is you know that anything that you pick in here is going to layer properly in the regimens the way that I described earlier. It takes all the science into account. Now, if you have any questions, let me know, and also follow me on LinkedIn, and we also have an Instagram account, Skin Type Solutions, that's made to educate your patients about, in a generic way, about the skin. Like, for example, this talks about how vitamin C helps with collagen. And our goal as a company with Skin Type Solutions is to improve skin health through patient education and getting patients the right skincare regimens. And we want to send patients to medical providers who use our system. So we build up our Instagram account to have followers, and when people ask us who to go to, we send patients to doctors who are using our system. If you want to learn more about the software, the Skin Type Solutions software, you can visit us at stsfranchise.com and learn more, and also sign up again if you want to hear more about anti-aging products or acne products or other steps in the regimen that we're going to go through later. Now I'm going to take time to answer some questions. If anybody has any questions, we're going to open it up. And
so, Dr. Baumann, we do have several questions, and we actually have someone also watching us from Argentina joining us today. So, bienvenido. Muchas gracias por estar con nosotros hoy. So we had another question here. Some dermatologists claim that the eye cream is just less concentrated face cream and therefore not justify the cost. What are your thoughts on this?
That's a great question about the eye cream. And so it depends on what's going on with the skin type. But I do believe that if you could use a barrier repair moisturizer instead of an eye cream, because the main purpose of the eye cream is to protect that eye area from the treatment product. So, for example, if you're using a retinoid or an acne medication at night, it gets on your pillowcase, and you close your eyes, it gets on your eyelids, and that can be very irritating. So the main purpose, in my opinion, of the eye cream is to protect the eye area. If the moisturizer in your regimen is protective, you can use that. Now, if you're trying to treat puffiness or dark circles or something of the eye area, it is good to have a targeted eye cream for that problem. But if you don't really have any eye issues at all and the eye cream is meant just to protect, it's okay to use the moisturizer. And that's a great question.
All right, fantastic. Another question from Catherine. And she's asking, are there other brands that contain appropriate ceramide ratio?
Well, it's not just the ceramides, it's the three lipids, the ceramides, fatty acids, and cholesterol. So originally, the Dove face products contained the right ratio, but then they discontinued their Dove face products. But the original work back in the 30s and 40s was actually done by Unilever, who owns Dove. So back in the 30s and 40s, Dove and Pond's were great. Now they don't have that technology anymore, unfortunately. The EpiCeram is the one I told you about. There is Xerophyte, which is made in Korea. It was made originally for people with atopic dermatitis. It has what's called MLE technology, multilamellar emulsion technology. And you may have seen a study about a month ago by Dr. Elias. You can find it at lesliebaumanmd.com. I talk about it, but Dr. Elias, who did the original barrier repair research, did a study. And he had no financial conflict with the study, where they used MLE technology moisturizers and put it on the skin and measured inflammatory factors in the blood and showed that there was less inflammatory factors in the blood when MLE technology moisturizers were used. So the one that you may have heard of is called Xerophyte, but that's only sold by physicians. And I think those are the only ones right now that are on the market. There used to be other ones in the past.
All right, great information. So we do have actually from Cecilia a comment, and she says, by the way, I love your products and your system, and so do my patients. And then she asks, can you use retinol during the day if you're not going out into the sun?
Okay, thank you. I think you said Sylvia?
That is correct, Cecilia. Correct.
Cecilia, okay. So I don't have a skincare line, by the way. This is software that works with any brand, but thank you so much. I'm glad that you like the products that we've approved. So we independently research the products. You cannot use retinol going in the sun, even if you're not going outside, because the blue light on your phone, the lights and the overhead lights in your office or your house will all inactivate retinol. So it needs to be used at night. Otherwise, it's not going to have any efficacy. The newer prescription ones like adapalene, which actually is now over the counter, and tazarotene are less light sensitive than retinol and tretinoin. But that's why we always like to put retinols or retinoids on at night and the very last step on top of the moisturizer.
Okay, one more question. We have Kevin asking, how long does a quiz take to take your skin type solution quiz?
When I first did it, it took a while because it had 300 questions, and then after we validated it, we got it down to 3 minutes. So in 3 minutes, we can learn so much about your skin. And I actually am at the point now, if I had the option between looking at someone's skin and having them take the quiz, I would rather them take the quiz because it gives me all this historical information that you don't get by looking at the patient. So for example, if they come to you and they have zero acne, but really there's somebody who breaks out every time they use a moisturizer, you're not going to know that by just looking at their skin. So it takes 3 minutes, but it gives you a lot of information, and it saves you a lot of time because you don't have to hear all the patient stories. Sure, you're like me. If you ask a patient, have you ever had acne? You get the long story of, well, I was at Nordstrom's and I tried on this product, and I normally don't buy products in Nordstrom's, but I tried it and I broke out. That takes a lot longer than 3 minutes. So I like the questionnaire because it really goes quickly.
Okay, in a very similar note, Nancy's asking, how long would it take to implement our system and getting herself and her clinic set up?
So what we do is we put shelves in the waiting room so that the patients will start to understand that there are different skin types, and that's part of the education process. So if the doctor decides to use our software, they work directly with the shelf providers and design them, and they pay for them directly to the shelf people. So the cost really depends on how fancy you want them to be. Some people do glass shelves with lighting, and other people have a smaller kiosk shelving. And that usually takes about 4 weeks. During that time period, we help you pick what products you're going to sell from those drop-down menus that I showed you. And we train your staff so that they know how to give the quiz, how to talk to the patient in the waiting room. We do a lot of role play. So really, we can have you up and running in about 4 weeks. Now, we are a franchise system, and franchise law is basically whenever we allow someone else to use our trademarks. And with franchise law, you have to have the FDD, which is called, it's like an informed consent, in your possession for 2 weeks before you're allowed to sign. So there is a mandatory 2-week waiting period. So somewhere between 2 and 4 weeks, we can have you up and running.
Okay, fantastic. We do have a couple more questions, but our hours is up at the moment, so we will be sharing, once again, the recording of this webinar, and you actually be getting a, once you logged out, you'll actually be getting a small poll of questions in regards to how you enjoyed the webinar and what other topics you would like to see. So I'd like to encourage everyone to obviously give us that feedback. And we look forward to seeing everyone. Once again, our next webinar will be on August 12th, the same time, which will be 1 p.m. Eastern Standard Time. And we look forward to engaging with you once again. Once again, Dr. Leslie Baumann, thank you so much for the presentation and answering all the questions. And we look forward to seeing you again.
Thank you all. I look forward to it.